What's up, cuz? Welcome back to the channel. My name is Rasheedah. If you are new, this is my little corner of the internet and I'm living my 40 plus life. It has been a little minute since I posted a sit down video and this video is a little bit overdue. I was supposed to record this at my 1 year mark of working in the OR, but here we are in October, almost November. But nevertheless, I'm here and I'm ready to talk. If you're new, welcome to the family. We're all cousins here. I am documenting my 40 plus life as a new nurse who graduated from nursing school just about a year ago. Well, it was over a year ago. I graduated in April 2024 at the age of 46 years old. And working in the OR, this is my first job as a nurse. This video is an update to my 1 year experience working in the operating room. And this video is for anyone who is thinking about going into the OR. You don't have to be over 40, you can be any age. This is my experience and how I've learned and how I've progressed and how I have developed my nursing skills in the operating room. For anybody thinking of making the switch to the OR or starting out in the operating room, this video is for you. So what drew me into the OR was just the surgical aspect of the operating room. I love surgery. I just love hearing about surgery. When anybody would talk about, oh, I had surgery, or a surgeon, from making the incision to the PACU, I loved everything about the operating room. I said, whenever I graduate from school, I want to work in the OR, and that's that. I don't want to work in med surg. I don't want to work in peds. I don't want to do home health. I don't want to work in the nursing home. I want the OR, and that's that. And so when I graduated, well, before I graduated, I applied to the operating room and I got in. Another reason for me wanting to work in the operating room was teamwork. I loved how when I was a patient and I had a C-section, the whole operating room, from the surgeon to the nurses to the anesthesiologist to the anesthesia techs, everybody was working as a team to take care of that one patient. And I loved having all the attention on me as a patient and watching everybody like scurry around getting things ready. I knew I wanted to be a part of that. Working in the OR is a special place. You have to have a special kind of need to want to be there. This is not med surg. It's not like PACU. It's not the ICU. These patients are under anesthesia and they need all of your advocacy and all of your help. Working in the operating room, you definitely need to have a strong stomach because you are going to see some things and you're going to smell some things, and you have to have the, I don't even know what it's called, but if if you don't got it, it ain't gonna work for you. Okay, so let's get into my experience. So when I applied, it took like 4 months because I was still in nursing school. I was in like my preceptorship. So I got hired right out of school, but it took me a long time for the whole process to go through. My job has a internship program where you are kind of like, it's an internship / residency because the OR is considered a specialty. So you will need to go through this internship / residency where you are in a 4-month program. I think it went from July to October. So about a year ago now is when I was done with my internship. So orientation and internship / residency. So orientation, residency, internship is all in one. You are orienting in your department, scrubbed in with your OR scrubs and everything, but you are also in your internship. So what we did was I would be in the OR for like 3 days, and I think we would have 2 days of class, or maybe 1 day. I think it was Thursdays, yeah. So 4 days I would be in the OR, and 1 day I would be off-site at another hospital doing our, what do they call it? Your didact. What is it called? Didact? But I think it's called didactic. And that is your in-school learning. You have an instructor, you have we had like 3 instructors at the same time, and pretty much that is, they're going over the ins and outs of the OR, how to be a circulator, how to be a scrub. We go over your instruments. We go over how to circulate, how to go get instruments, how to work instruments, how to work the equipment. The one thing I did not anticipate working in the OR was all the equipment that goes into these surgeries. Your equipment is going to be your OR table. You're going to have your electrosurgical equipment, which is what they use to cut tissues. You're going to have to learn how to plug those in, how to turn up the strength, turn down the strength, learn how to position patients, how to work the OR table, there's a remote that you use to turn your table up, to turn it this way, to turn it that way, because the surgeons want lateral, they want the other way, they want horizontal, they want Trendelenburg or reverse Trendelenburg when you are turning your patient this way or that way, if they want the organs to shift downwards or if they want the organs to come away from the site. You need to learn how to work that table. There's the C-arm, which is your radiology equipment. And we have a mini C-arm, which we can kind of control. And that is what they use in like orthopedic cases for hands, where they want to x-ray where they're putting metal implants and rods and screws. And then you have your patient warming system, which is what they use to warm patients during traumas to keep their body temperature at the right temperature. I learned most of my hands-on being hands-on. You, just like nursing school, you learn how to take the NCLEX. Like, you're not learning how to be a nurse. I learned most of my skills for the OR being hands-on, and this is what they teach you. I learned a lot of what I know now on the floor. I did not learn a lot of this in the actual internship. So my orientation was pretty much a year. And after we had our residency / internship, we did have a graduation, which we had to take a test at the end. And that exam is through the AORN, which is the Association of Operating Room Nurses. We had to take a test at the end. We had to get like an 80 or 85 to pass and get our certificate. So I think I got like an 87 or 88. I just passed it. Typical. I passed it and I got my certificate, and I was able to come out of my internship and then be an orientee with my preceptor. Orientation was pretty much a year. I got off of orientation in June, which is when I was supposed to make this video. But I got off of my orientation in June of 2025, and then I was on my own. I no longer had to be in a room with a preceptor or another nurse. I was able to run cases by myself. And that's when I felt the most independent. You love to have someone with you to help guide you, but at some point you're gonna have to like do it on your own. And I love having the autonomy to be able, oh, can I get a 3O monochrome? Can you get another Bovi pad? Can you get a like another instrument? I knew where most of that stuff was. I'm still learning today, but being able to be off orientation and to be on your own is scary, but it's also a really good feeling of independence. My preceptor was, she's really sweet. She was always helpful. She did kind of like throw me to the wolves one day, and I really didn't appreciate that, but it is what it is. And then I was like, what is she doing? Like, she kind of like left me, I'm not gonna say she left me hanging, but she kind of did, because there was a orthopedic case that I was in, and we needed to have fluids hung for irrigation, and we needed a lot of stuff plugged in. Lighting, scopes, all that, camera, and I didn't have the fluid bag. Like, she let me set up everything by myself, but I forgot that. And I remember standing there like holding the irrigation spike, and I was like, I'm missing something. And she was just like,
and I was like,
like, girl, why you left me hanging like that? But she was like, well, I did that to teach you that you need to have your stuff together. And I was like, noted. Mind you, I'm old enough to be her mother. Another thing, I work with a lot of nurses who are way younger than me. Some of these nurses are my age, some are older than me, but a lot of them are younger than me. And that's another thing I had to get used to, was working with people who are, I'm literally old enough to be their parent. And for the most part, everybody is respectful, they cool, they chill, we talk, we laugh, just like any coworkers. So the learning curve, let's talk about the learning curve. I'm still in a learning curve, and there's a lot with the OR. Like, there are some days where I feel like, okay, I got it. I don't need my notes anymore. I have a big bag of notes, which I've really lost. I don't know where my notes are. I think I left them in a room somewhere. But I have like this big bag of notes where I wrote down everything, any little nuances. This surgeon likes that. This surgeon wants that. This surgeon uses this. This surgeon don't use that. that's where the learning curve is. When you could be doing a GI, not a GI, you could be doing a hernia case at 8 o'clock in the morning, and then by 2 o'clock, you're doing a foot case. That is 2 different body parts. That is 2 different machines. That's 2 different instruments. And that is a learning curve. You are going to have to switch from gallbladder to GYN, GYN to foot, colorectal to ear. Like, you have a learning curve with every situation that you have, and that could be hard. And sometimes I used to be like, I can't do this. Like, I can't do this. I'm switching my brain on and off, but it's actually a good thing for me anyway. I love learning new things. I love having the experience of, well, turning off my brain for that kind of procedure and turning on my brain for that kind of procedure. You get it? They say that it takes about 2 years for you to feel like the light bulb just went off. I got it. And I believe that, because I'm a year and 4 months in, and I'm still like, wait, what am I supposed to get for this? I forget, because we don't do the same cases every day. We don't do the same cases every week. You could, like I said, you could be doing Monday, you're doing hands. Tuesday, you're doing a gallbladder. Thursday, you're doing GYN. Friday, you're doing colorectal. And then they throw in an amputation of a toe at 3 o'clock. It flips and flops. I have made many mistakes along the way. I have miscounted. I have not put the SCDs on a patient before, which is the warmers that you put on the leg for the patients who are under anesthesia, so that they don't get blood clots. The blood is still circulating. I forgot to do that one time. I've done several things that were mistakes, but you learn from them, and I make sure I'm never gonna make those mistakes again. So what I love about the OR, I do love the teamwork aspect. I am never left alone. I think if we're running short, that's the only time we're like, oh, damn, I gotta do this by myself. But for the most part, we have a good team. There's always 2-3 hands on deck to help you bring your patient in, help you clean up your room during turnover. I can always go on our computer system and text, hey, can you grab such and such for me for the people that are free? There's always somebody to help. The charge nurse is always there to help. I never, ever feel like I'm thrown to the wolves, except for that one time with my preceptor. But for the most part, I am never by myself. I'm never truly alone. There's always somebody to help. And I love that about the OR. That is the main thing I love about the OR. I never see like surgeons joking around or, fooling around. They are very serious. And when they have residents or students with them, I love how they teach. I mean, I work at a teaching hospital, so they kind of have to, but I love how they explain everything. And sometimes they'll turn to me and be like, Rasheedah, have you seen this before? And I'm like, no. And they're like, come over, sterile, keep your sterile, feel good. And I'll take a peek over and they'll be like, hey, this is such and such and such, and you want to make sure. I love how they teach and how they are very serious about their patients. They keep their patients number one. Do I have a favorite case? I thought I liked cysto, which is cystoscopies, but cysto is not my favorite anymore. Cysto is a urology case where they do stents for kidney stones and bladder stones. It is very intense, those cases, and it's very busy, and there's a lot of moving parts, and I love to stay busy, which is why I thought I loved cystos first. But now I'm like, this moves too fast for me. And I think cystos are forever gonna be my least favorite at this point, because they move so fast, and because there's a lot of fluid. There's a lot of fluid in a cysto case where you need to be making sure that your bag is not running dry, and you have extra to come and spike as soon as the next one. You have to have your eye on that bag. We'll talk about cystos another day, because that's a really, they can be difficult, but I'm not going to dwell too much on that. But cystos are my least favorite, and I'm going to say GYNs are my favorite, like the GYN hysterectomies, and when they're doing like total hysterectomy, or when women are getting their fallopian tubes taken out, or ovaries. I love the fact that I get to collect the specimen. I get to put the specimen in. I get to put the formalin in. I am keeping my eye on the robot, keeping my eye on everybody who's in the room, making sure that everybody is maintaining sterility. And I love just being in control of the OR room. If there was anything I wish I knew before starting, was the robot. I did hear about robots, but I didn't know that I was gonna be driving the robot. I thought the surgeon was, you know, the robot was just there and they just do whatever they do. No. The circulator is the one who is driving that robot up to the patient, and you have to be on the patient's left or right or in between. You have to make sure that it's right. And depending on your surgeon, if the surgeon is not patient, he or she is going to express frustration. Like, is this your first time? Okay, no, you need to back up. And the robot is big and wide. It's not like a simple, you know, coming up to, and it's not simple at all. So that's one thing I wish that I knew, that this big gigantic robot existed and you have to be the one to control it, position it, set it up. That was a lot. I never knew that was a thing. So far I've learned that's not my favorite either, but I have been doing it, and for some reason they're calling me like the robot queen. I'm not. There's other robot queens, but I emphasize so much and I get so much anxiety when it's time for me to push that robot that I kind of get it right on the first try because I'm so anxious about it. And one time one of the surgeons was like, okay, no, I can't have new people doing this. This is not the time to learn. I need somebody that knows how to do this, because granted, the patient was like 90 and had like a big mass in her cervix or her ovary or whatever. And he was not trying to see me playing around with that robot. So he was like, no, I need somebody who knows what they're doing. Speaking of that, I had this surgeon, on Friday when I was there, or Thursday? And I started building up that anxiety again. I was like, this doctor does not like how I drive the robot up. But this time I did it and it was boom, boom, boom. He was like, wow, have you done this before? He didn't remember me. He was like, hey, is this your first time? And I was like, no. And he was like, oh, okay. So that was my little happy moment. Advice for my nurses who are over 40. Anybody really. This can be done. You can learn. If I can learn how to get all these cases together and remember instruments and learn a whole new skill at the age of 46, I know you can do it. I don't even care if you're over 50 or if you're 30. Your experience is gonna be valuable. I never worked in an OR before. I've never worked as a nurse anywhere before other than my preceptorship on med-surg, you know. Any kind of experience that you have coming in is gonna help you if you wanna work in an operating room. Yes, it is a different beast. This is a specialty. You're gonna have to learn how to deal with surgeons and their attitudes and their personalities. You're gonna have to deal with other nurses and their personalities and attitudes. You know what I mean? But do not let age stop you. You can learn, you can do it, you can learn a new skill. It's okay to not understand it right away. You don't even know how many times, like when we're doing cultures. I always have to get help with cultures because even though I worked in a lab for 15 years, it's different when you're collecting the specimen from the source. Just ask questions. You're not gonna learn everything right away and you're not gonna get it the first time all the time. Take notes, ask questions. I will ask the same question to 5 different people and come up with my own concept. I'll ask different nurses, oh, how do you do this? I'll just pretend like I never saw it before. Oh, how do you do this? I've never been in this case before. I might have, but I wanna see how they do it so that you can develop your own system. When I'm doing timeout, the room is mine. I have control of the room as a circulator, and I am like, all right, the doctor's like, can we do a timeout? I'm like, yes, I have that patient's consent in my hand, or if it's on the computer, I'll pull it up. Yep, I have the consent pulled up. That does agree. We're working on the left side. We have fire water. We have this, we have that. My boss so-and-so is here. I'm here, she's here. You take control of that room. So in closing, I want to say, I have come a long way, and people will tell me that, Rasheedah, you're doing so well. One of the CRNAs came up to me and was like, I remember when you first started and you have grown so much. We have the same birthday, by the way. You have grown so much and I'm proud of you. You're doing a good job. And I had to give her a hug. I was like, oh my God, I feel so good. This is the best thing anybody said to me in a long time. And I can tell that I've grown. I've learned a lot. Operating room is not some place to play. It's just not. And not everybody belongs in the OR, and not everybody can take the operating room. Year one was what I expected and a little bit more, like the robot and getting cultures and stuff like that. My reflection is I appreciate everything I've learned. I appreciate all the experiences that I've had. I appreciate the mistakes that I've made. I love when the surgeon is like, thank you for a good day, or the CRNA is like, thank you for communicating with me. You make sure that the patient is good while I'm up here, you know, trying to keep them alive. I love when people give me feedback. I love being acknowledged. I've learned that, you know, there is a lot of accountability working in the operating room, and I'm always going to take accountability. If I mess up, I'm going to say, damn, my bad. I didn't know that we were supposed to do that, or I didn't know I was supposed to do that. My first year in the OR was a really great experience. I do like it. I work 3/12s, and I'm off 2 days one week, and I'm off 1 day the following week. So my schedule is really good. I get to have a lot of flexibility. I have a second little part-time per diem job where I do that on my days off. So I'm able to go to my son's games. I'm able to, you know, sleep all day if I want to. Again, I know that I'm not going to be pushed into the fire when I go back to work the next day, because we have an awesome team. Just want to say, if I can do it, you can do it. If you have any questions, feel free to email me. My email is in the description. I do have a newsletter, so check that out as well. And again, if you have any questions, you can always hit me up. Leave me some comments. Are you going to go to the OR? Are you in nursing school? Do you want to work in the OR? Did this video help you? Let me know, and I will catch you in the next one. Bye.